In a significant exchange on Capitol Hill, the structure of modern American healthcare has been placed under a microscope. As CVS Health expands its reach beyond retail pharmacies into insurance, clinical care, and drug manufacturing, lawmakers are questioning whether this one-stop-shop model serves the patient or merely secures corporate profit. This story matters because it addresses the core mechanics of why prescription drugs and medical services remain prohibitively expensive for millions. By watching this analysis, viewers will gain a clearer understanding of the captive strategy and the growing legislative appetite for breaking up healthcare conglomerates.
Thank you so much, Mr. Chairman, and apologies if we have to move quickly here due to the time. Thank you to all of our witnesses for coming here today. Mr. Joyner, you are the CEO of CVS Health, correct?
Correct.
And I actually don't know how many Americans know this, but CVS Health owns Aetna, the health insurance company, correct?
Correct.
And CVS, which owns Aetna, also owns Oak Street Health medical clinics, correct?
Yes, it does.
And in addition to that, they own, of course, CVS pharmacies, and CVS Health also owns CVS Caremark, the pharmacy benefit manager, which helps negotiate some of these rebates and prescription prices, correct?
That's correct.
And CVS Caremark processes nearly 30% of all prescriptions in a given year. And so,
This segment is a factual establishing of the corporate map. From a logical standpoint, the representative is laying the groundwork to demonstrate that CVS is no longer just a pharmacy, but a closed-loop system. The CEO's confirmation of these facts provides the evidence needed for the subsequent argument regarding market dominance.
In other words, CVS Caremark helps determine the prices that patients pay for a third of all prescriptions in the U.S. In fact, I was following one of CVS's investor calls where they really laid out quite clearly what this means if you are a patient. This is what's known as a captive strategy. And CVS, in the investor call, used the example themselves of a patient known as Kate. Kate has an Aetna health insurance plan right here, and which is owned by CVS Health. She then goes to a CVS pharmacy. She's connected to an Oak Street Health medical clinic. She sees a doctor at Oak Street Health who prescribes her medication. And then she goes to fill that prescription at a CVS pharmacy. So the price Kate pays for that medication is dictated by Aetna, CVS, Caremark, and they also own the drug manufacturer Cordivis. Mr. Joyner, this is quite a bit
Rhetorical visualization. While the CEO argues this model works well for the consumer, the logical gap lies in the lack of choice. For an informed viewer, this highlights the captive nature of the strategy. When the insurer, the doctor, the manufacturer, and the pharmacy are the same entity, the traditional competitive pressure to lower prices is effectively neutralized.
Of market concentration. Wouldn't you agree?
No, I wouldn't agree that it's market concentration. I would suggest it's a model that works really well for the consumer.
Yeah, I think it works very well for CVS. I think, in fact, you all said on the call that you all call it a fully engaged member. It's great marketing there. Fully engaged member unlocks sizable value for payers and CVS Health. So the health insurance gets a cut, the pharmacy benefit manager gets a cut, the drug manufacturer gets a cut, and the patient gets screwed.
Here we see a conflict of interpretation. The CEO uses corporate language to frame efficiency as a benefit, while the representative focuses on the distribution of that value. The argument that this unlocks value for the company is factually supported by their own investor reports, but the claim that it benefits the consumer is the point of contention that remains unproven in this exchange.
I think the Federal Trade Commission has also found that healthcare conglomerates like CVS Health charge more for medications filled at their pharmacies. We're talking about 1,000% markups on medications for cancer and HIV. And, I think this is actually an interesting point of common ground that I may have with some of our Republican colleagues here in this hearing. Because whether you're a blue-blooded capitalist or a card-carrying democratic socialist, I think corporate monopolies are a problem. And this vertical integration is destroying people's ability to access care.
This is the most critical evidence-based claim in the video. By citing the FTC, the representative moves from theory to specific economic harm. The mention of common ground with Republican colleagues suggests that the opposition to healthcare monopolies is becoming a bipartisan issue, shifting the narrative from a partisan attack to a broader public interest concern. We know for certain that CVS Health has successfully integrated every stage of the healthcare supply chain, a fact the CEO acknowledges. What remains disputed is whether this integration leads to efficiency for the patient or extraction of profit for the shareholder. As the FTC continues its investigation into these markups, the focus for viewers should remain on whether future legislation actually forces these entities to separate their insurance arms from their pharmacy and manufacturing wings.